Hi doctors, time is precious. Okay, time is precious. Today we are going to discuss very important topics. Okay, very important topics. Neoplasm, bone tumors, and the thyroid tumors, and something related to osteology. So what I have to say is time is important. Okay, just because we have 10 days, around 10 days remaining for NEET PG, 10 to 11 days. This 10 to 11 days, you have to revise fast, do the PYQ and revise PYQ revision. This is your only thing, and don't go for studying new things. This is very important. Please stick it in your note or wall. Revision and PYQ revision. That's all. Okay. See, now we'll see. Yeah, we have bone epiphysis, diaphysis. Okay. Epiphysis, diaphysis, bones. Okay. Epiphysis, diaphysis, and metaphysis. Different bone parts are there. Just to see. So we know. Whenever question, there are one to two sure question from these bone tumors. Okay, definitely one question will come. Second question depends upon the pathology. Sometimes because of pathology it will come. So this topic is in orthopedics and pathology as well. So there will be some important areas, some important words, and some important age group, or the position, the site, location. So we can come to the diagnosis. So very easy. So we have epiphysis, we have diaphysis, we have metaphysis. So epiphysis, diaphysis, metaphysis, EDM. Okay. So we have these three. Okay. We have epiphysis, diaphysis, and metaphysis. Okay. You can see the diaphysis here. The body is the diaphysis. You can see the epiphysis. You can see the epiphysis. You can see the metaphysis also. So here what I have to say, there are some tumors are specifically into that location. For example, epiphysis, you can see chondroblastoma, giant cell tumor. So epiphysis, ECG, epiphysis, chondroblastoma, and the giant cell tumor. This is important. This C, there are many C's, okay, but mainly the chondroblastoma. So what important here, growth plate will be visible. It is in the child, okay, and in adult giant cell tumor there is no growth plate, okay. That is the differentiation, okay. So what we can say, ECG, epiphysis, chondroblastoma. So I will say ECG, BCG. What? Why ECG, BCG? ECG, BCG, E for epiphysis, ECG, chondroblast, B. So B is coming, chondroblastoma. That's why chondroblastoma, and G for giant cell tumor. So E, epiphysis, ECG, and C is there. We don't know chondroblastoma or another C. So BCG. Remember ECG, BCG. B for chondroblastoma. So B is coming, blastoma. So that's why ECG, BCG, ECG, epiphysis, chondroblastoma, and giant cell tumor. This is very important. Okay. In the diaphysis, when it comes to diaphysis, okay. So I will remember like Dior. Okay. DEO, Dior. So Dior, I'll write like Dior. Okay, Dior. Like this I used to write. Okay. Why? Nothing but E for Ewing sarcoma, O for osteosarcoma. So I'll write like Dior. So I'll write like Dior. Okay. This is very important. Dior. Okay. So I used to make a mnemonic like this, Dior, or osteosarcoma, Ewing sarcoma, and the diaphysis. This is very important. So diaphysis, Dior, ECG, BCG, epiphysis, BC, chondroblastoma, and G for giant cell tumor. This is very important. And when it comes to other, so if we study these two, we don't want to study the further. So metaphysis means osteosarcoma, metaphysis, osteochondroma, aneurysmal bone cyst, unicameral bone cyst, all things will come in the metaphysis. So we will study about the epiphysis and the diaphysis. Epiphysis, ECG, BCG, Dior, osteoma. All other tumors will come to metaphysis. So according to the location, so it is easy now. So we have epiphysis, diaphysis, epiphysis, chondro, chondroblastoma, giant cell tumor, diaphysis, Dior, Ewing sarcoma, osteodosteoma. Okay, this is enough. Okay, this is enough. So whenever their question will come, diaphysis affected, diaphysis definitely they will ask these two only, Ewing sarcoma and osteodosteoma, especially Ewing sarcoma. So you can go epiphysis, chondroblastoma, so very important, and giant cell tumor, and we'll relate the X-ray picture like that. So when it come to location, we discussed the location, okay, in the bone. Then we'll see the site in and around knee joint, in the humerus, in the elbow. Different locations are there. So when we see the site, this is also important. Around the knee joint, okay. Most common site for overall tumor is around knee joint, okay. So around knee joint, most common site for overall joint, that is most overall carcinoma, the most joint affected in and around the knee, distal femur. So we know we have femur from here, we have tibia and the fibula. So this area around the knee, distal femur and the proximal tibia, this area is affected more. Okay, so this majority of the cancer, this is the common area. Okay, this is the common area affected. Okay, clear. Now we have something called important. So we can see proximal humerus. Okay, simple bone cyst are most commonly proximal bone cyst. Proximal humerus, we can see the simple bone cyst. That is also very important. Okay, spine, we have hemangioma, osteoblastoma, OB, ECG, BCG, and metastasis. Metastasis most common is spine, hemangioma, osteoblastoma. These are tumors most common. This is not that very important, but sometimes what happen in the proximal humerus, simple bone cyst, you can differentiate from the wrist features of the other cyst type lesion. Okay, just leave, this is just an extra point. Okay, now we will see the age group. So they will definitely tell a child, okay, child or adolescent or elderly. So this term will be middle aged, like that. The terms will be there. So whenever you see Ewing sarcoma and primary osteosarcoma, okay. So Ewing sarcoma, especially it is occurs in the second decade and the first decade. So it is from 10 to 20 years, it is more common. Okay, Ewing sarcoma, ECG, BCG, and primary osteosarcoma. Okay, so we can see this is very important in the child age. Okay, so primary osteosarcoma and Ewing sarcoma are in the child age. You can see less than 20 year. Okay, less than 20 year. Okay, very important. Especially they will tell 8-year boy or 10-year. So Ewing sarcoma, 11, 12, 13, 14, Ewing sarcoma and primary osteosarcoma. This is very important. Okay, this is very important. So clear. Now what I have to say is, so you can see the 20 to 40, 40 to 60. So 20 to 40, it is nothing but the giant cell tumor. Okay, this occurs after the skeletal maturity. After the skeletal maturity, giant cell tumor is important. 40 to 60, some secondary osteosarcomas. Primary osteosarcomas are between 10 to 20 years, like before 20 years, the childhood age or adolescent age. But the secondary osteosarcoma post 40 to 60 age. Okay, more than 60, it is very easy. Metastasis, multiple myeloma, adamantinoma, chordoma, all these. Okay, metastasis and all, majority post 60. So here what we can see, this Ewing sarcoma, and you can see the osteosarcoma. It is having age between 10 to 20 and 40 to 60 also. Bimodal age distribution is there. Okay, more than 60 metastasis. Okay, and you can have to see giant cell tumor. It will never occur less than 20 years. It is occur after skeletal maturity, that is giant cell tumor, G, ECG, BCG, G, giant cell tumor. It is occur after skeletal maturity. You should know this point enough. Okay, now we will go and see the individual tumors. So there are many tumors, but we are going to study the very important, and definitely questions will come from that area. Such kind of questions we will discuss. Okay, that topic we will discuss. So you see osteosarcoma, in and around knee, bimodal distribution. See 10 to 20 and 40 to 60. Okay, or elderly. See, point is coming from there. Age distribution. Location, metaphysis, no, ECG, BCG and Dior. So this is metaphysis, not explained there, especially in the long bone. So distal femur. So in and around the knee, especially in the distal femur. So this is very important. So we can say a 50-year-old person or a 15 or 16-year-old boy. So this are bimodal age distribution. Okay. So here osteosarcoma metaphysis, location in the metaphysis. Okay, on the long bones in and around the knee. Definitely it will go for the osteosarcoma type features. Okay. Okay. So what are the extra we will discuss that next page. Okay, Codman's triangle, very important. Okay, and microscopy, new bone formation. So new bone formation. So lace-like pattern. So Codman's triangle. So I will show that X-ray also. So now you can see here there is something here. Okay, so there is something here. So you can see here. See a triangular like this is coming out. Okay, so that is known as Codman's triangle. Okay, you can see the lesions. There are classical. Just we should know this is enough. Okay, something triangular thing come out known as Codman's triangle, sufficient. So history, maybe a boy 15 to 16, 20 year, or some elderly patient, metaphysis. Okay, and distal in and around, and we have Codman's triangle. So definitely we can go for osteosarcoma. That is important. Okay, and we have something called osteochondromas. Osteochondromas are there. So see, it's like mushroom shaped protrusion will be there. Osteochondroma, we can say mushroom shaped protrusions will be there. Okay, you can see some mushroom shaped protrusions will be there. Okay, okay, clear. And we have giant cell tumor also known as osteoclastoma, OC, giant cell tumor, ECG, BCG, epiphysis. So definitely epiphysis, that is very important. Okay, so and here you see the association, females are more affected on middle age, after skeletal maturity, lower end of the femur, multinucleated osteoclast type giant cells are there. That's why giant cell tumor, osteoclastoma, osteoclast type activities cells are there. So what we can see in osteoclastoma, okay, giant cell tumors with multinucleate giant cell. You can see the giant cells here, giant cells, so many giant cells you can see. That is very important. Osteosarcoma, you can see lace-like pattern of newborn formation. Lace-like patterns of newborn formation. You can see the lace-like pattern of newborn formation also. And you can see the mushroom shaped in osteochondroma. That is also important. So that is clear. Okay, that is clear. Okay. So that is done. Now we are going to see another tumor known as Ewing sarcoma. Ewing, where was E? Ewing sarcoma, pediatric, bimodal, age less than 20 years. See, Ewing sarcoma. Okay, that is very important. And it is Dior. We discussed in Dior. This E for Ewing sarcoma. Okay, so it is in the diaphysis, very important. So Ewing sarcoma, there is some classical finding like small round blue cells with rosettes, onion skin appearance. These are very classical of Ewing sarcoma, which is occurring less than 20 year. There only you will get the answer, less than 20 year, less than 20 year. Diaphysis of the long bone. So you can see the onion appearance. You can see here, this onion type appearance will be there. Okay, and you have small round blue cells. That is very classical. Small round blue cells, they have so many differential diagnosis. So you can see the small round blue cells here. Oh, this is also very important. So these are very important, we can say. Okay, and that is clear. Okay, clear. So these are the basic summary of the bone tumors. This is sufficient. No need to study so much in detail and all. So from here we can eliminate. See, there are further questions. Okay, we can say chondrosarcoma is there. Chondrosarcoma. So it is also important. So whatever we didn't explain, osteosarcoma, though they can ask. Okay, Codman's triangle, they can ask. Bimodal age distribution is there. Okay, giant cell tumor. Okay, after skeletal maturity, age. Okay, and the female and the multinucleated osteoclastic cells type giant cells, and Ewing sarcoma, pediatric less than 20 year, and diaphysis of the bone, and onion skin appearance, and that small round blue cells. So these are three things, the potential question. If you know this, you can eliminate the other options. Easy, not difficult. Okay, and you should know the association of location and some age distribution then it is easy. Okay, you can clear. And that's typical X-ray features only they'll give. Onion skin appearance, Codman's triangle they'll give, and this kind of histopathology, this is pathology, very important. And giant cells, you can see the giant cell. These are important. Okay, okay, clear. Now, yeah, now we are, so what we completed bone tumors. Now we are going to see the thyroid tumors. Thyroid tumors. These are very important, and usually they are asked one question. This is into patho, surgery, very important. Okay, patho and surgery. So nothing but thyroid tumors. Okay, we have papillary tumor, follicular tumor, papillary tumor, papillary carcinoma, follicular carcinoma, medullary and anaplastic. So we can say anaplastic, it is very dangerous and it's the least common and it's have the worst prognosis. Here P53 gene mutation is there. Anaplastic, P53, worst prognosis, and that's why it is least. So worst prognosis things will be in the least usually. The most commonly we have high, better prognosis. That is important. Okay. So we discussed about anaplastic. It is clear now. Now we have papillary, follicular, and medullary. Very simple. We are going to solve that also. Okay. So what is there in papillary? Papillae, definitely. Follicular, follicles will be there. Medullary, related to parafollicular C cells and related to some important points. So we will see that. Okay. We will see the images here. Then we'll come back to the table. Papillary thyroid carcinoma, you can see the papillary formation. You can see the samoma bodies. These are nothing but the, important. Okay. And you can see the nuclear grooves, and you can see something called this classical eye. See, you can see the usually eyes are like this. Okay, but in the cartoon it is eyes are like this. These are known as orphan eye, orphan Annie eye. This is a cartoon. Okay, cartoon character. You can see the orphan Annie eye. That's why. So this papillary thyroid carcinoma, there are papillae are present and follicles lined by optically clear nuclei, orphan Annie nuclei. Okay, it is like this. Okay, it is like this, clear. And coffee bean nuclei are present. And you have samoma bodies are present. These are the classical features of papillary thyroid tumors. Okay, and this is very important, and definitely they are asking this regularly because coffee bean nuclei, samoma bodies, papillae, orphan Annie eye nucleus. So these are all very important. Okay, and we have something called follicular variant of papillary carcinoma thyroid. Okay, cells are arranged in follicles, but nuclear features are that of papillary cancer. There is one variant of papillary tumor, that is follicular variant. So here what I explained is, you can see the papillary formation, you can see the eye, orphan Annie nucleus appearance, you can see the samoma bodies and coffee bean nucleus. These are very important. Okay, papillary carcinoma thyroid. Okay, then we'll discuss again in the table. And follicular carcinoma, we can see so much follicles. Yeah, important. And here this one important, cannot be diagnosed by FNAC, as FNAC cannot detect capsular or vascular invasion of the tumor because so much follicle. So we'll go, FNAC will do, we cannot differentiate. So FNAC better avoid in this case, or it cannot give proper diagnosis of follicular carcinoma in this case. Follicular carcinoma cases, because of the follicle is difficult. And you see medullary carcinoma thyroid. So this is very important. Medullary carcinoma, you can see some materials here. This is known as nothing but our amyloid present. And here, because it's calcitonin, because parafollicular C cells. Okay, so this is important. And the Rett gene in chromosome 10. Okay, and we have apple green bifringens in polarized microscopy also. And tumor marker is calcitonin because parafollicular cell calcitonin. Okay, so calcitonin, that's why amyloid. So you can see this is also very important. Now we'll summarize the table. So in the table we can come and clear it. So papillary cancer, which is most common, and there is some association, history of radiation, thyroglossal cyst, Hashimoto thyroiditis. This is definitely lead to. So history of radiation and thyroglossal cyst, and later developed a tumor that is going to be papillary thyroid tumors. Okay, follicular cells are there, and we have to know here these are in best prognosis, and papilla is there, orphan Annie nucleus, samoma bodies. These are the classical features. Okay, when it comes to follicular, we already told follicular, so much follicle. This is most related to iodine deficiency and multinodal MNG, multinodal goiter follicle problem. So multinodal goiter, long standing goiter, it is leading to follicular type cancer. Okay, and here follicles are seen and KRAS mutation is there. Okay, that is also important. When it comes to the last and important person, nothing but our medullary, it is originated from the parafollicular C cells. Okay, and we can associate with MEN2 syndrome, and amyloid depositions are seen. That is also important. So this is a summary of thyroid tumors. This is enough for your exam point of view. So if you want to know it's a detail, NEET exam will finish on August 31st or the next month. First you start again reading in depth. If you want to take surgery, take the marrow, whatever, study in depth, Corbitier, full video, watch, make your concept ready. But exam point of view, this is enough. Okay, enough. Okay, this is the summary. And yeah, now we are going to discuss very important thing known as osteomyelitis and causing organism. Definitely they are asking a simple direct question. If you know, you will get 4 mark. If you don't know, 5 mark gone, because you are going to attempt this. Okay, so you know the blood arrangement of the blood supply here. Because of this hair loop arrangement of venous, there will be sluggish flow of blood here. So any infection or pathogen is there, it will grow, it will cause infection here, it lead to osteomyelitis. This is simple physiology, simple anatomy and physiology of that. Okay, now if I am discussing, the most common organism for osteomyelitis is nothing but our Staphylococcus aureus. Wherever question is non-specific, we can tell it is Staphylococcus aureus, Staph aureus. So the Staph aureus, this is the stuff causing maximum osteomyelitis. So when it comes to any other, so we can say sickle cell, S4S salmonella, sickle cell disease patient, S4S salmonella. Okay, and nothing but our IV drug abuses, IV drug, pseudomonas in the IV drug abuses, and animal bite, Louis Pasteur, animal bite. Okay, Pasteurella, animal bite, Pasteurella, and human bite, Aikenella. So Aikenella, Kingella. So human bite, Aikenella. And prolonged parental IV fluids or parental therapy, fungal organism cause osteomyelitis. So these are the important topic. Okay, these are the very important topic you should know, because sickle cell may S4S salmonella typhi, salmonella, and IV drug abuses, it is pseudomonas, and animal bite, Pasteurella, and human bite, Aikenella, and a prolonged parental IV therapy, fungal organism. So this flow, and why this is osteomyelitis happening, Staph aureus, this summary, this is very important. So we are summarized about the thyroid tumors also. This is enough. Other points you can rule out, and you can come to the conclusion from this area: history of radiation, thyroglossal cyst or thyroiditis, papillary, any long-standing goiter, follicular, and calcium-related, calcitonin, ACAL, amyloid is present, MEN2, it is going for medullary. Anaplastic is the worst, P53 mutation, and it is the least common, most dangerous one. Okay, that's also important. When it comes to ortho, this bone tumors, Osteosarcoma they can ask, giant cell tumor they can ask, Ewing sarcoma. These 3 questions only they will ask, 80% they will ask from this topic only. Rarely they will go to the other topic, and we have discussed the important point also. You should know this site, location and site and the age distribution, it will be very easy. So this today's topic is small but very important. Please watch this, make into your 20th notebook. Thank you. Immediately I will be uploading the next video also soon. Within 4-hour gap I will be completing everything before 22nd and 23rd, and rheumatology videos I had prepared, I will upload that soon. And I will be doing pharmacology, very important thing, only for example of important things, and PYTs. I'll briefly within 1.5 hour, 2 hour, I'll complete pharma also. That also I have a single plan. And yeah, because of some duty stress and difficulty, last 2-3 days I couldn't upload regularly, but still 10 to 11 days are there. We will do our best. Try to revise well. Do your best. All the best. Prepare. Don't feel low. Yeah, feeling low, mentally down. Yeah, many people quit already. I know few people quit. I know those students are texted me like very badly. As sir, you helped me a lot. You are giving so much motivation, but I am not the right candidate. And I feel very sad for them. please never think like that. You, even though if it is 2 days for exam, you are not the wrong candidate, you are the right candidate. 2 days will do magic, 20 days will do magic, 100 days will do magic. Don't think like that. Even every important hour, day, time, how much minute you can save, how much time you can put, that will matter. So some people, they are putting effort, they are like, my target is achieving only 60%, my GD score is still low, I'm not able to do this. Nothing like that. Just to see, put your effort, time, attend the exam, come back. We'll see the result later. Whatever the results, we'll see later. But you should completely give your exam. Even you are feeling 100% confident or 75% or underconfident, give your exam. After exam, relax, analyze, then we'll plan whether we'll take a seat or we'll go for one more year. We'll analyze that. So our life is important, our priorities are important. So this is also very important thing. Yeah, correct. But this is never going to judge your life, never going to determine your life. You are the person to decide whether your life is going in a smooth way or bad way. You are the person to decide that. So the power in your hand, your mind, your mentality, your mental health, physical health, your mentality, that is all important. Okay, thank you so much, students. I'll come with another video very soon. Okay.